So here are the objectives for the presentation today. So by the end of today's presentation, I'm really hoping that you have a better understanding of the historical and sociocultural factors that contribute to the mental health challenges faced by many African American students. I'm hoping that you're able to identify culturally responsive strategies and interventions that promote positive mental health outcomes for African American students. And then lastly, this is kind of connected to the second objective, learn how to create a safe and inclusive learning environment that acknowledges and validates the experience of African American students. Now, African American mental health, as Abraham mentioned, is one of my passions. So this is really something that I could teach a class on, and I have taught classes on the psychology of the African American experience. So I actually had a really hard time narrowing down what the focus was going to be. So I'm going to focus mainly on the family structure. I'll talk a little bit about racial identity, which I think is really important when working with African American students. I'll talk about the protective role of religion and spirituality, issues related to education, which is obviously important to what we do when working with students. And then lastly, I'll talk briefly about the impact of racism and discrimination. So before I do, let me share a little bit about my story. Okay, so this is a picture from a yearbook of my second grade class. So I was actually raised in Mobile, Alabama, which really at the time was predominantly Black and white. There wasn't very large pockets of other, and that's actually, I believe, still true today. But I went to a predominantly white, small Christian school. And this is a picture of my second grade class. And as you can see, I mean, it's actually quite diverse for me to say, okay, so, predominantly white school, but this year was unique. I'm not sure if you can see my cursor, but Cecil and Lauren in the 1, 2, 3rd row, the two little African-American kids there, they're twins. On the next row, that's my cousin, Titi. He lived with us for a couple of years. I'm actually on the last row, always last. My last name is Wiggins. So always at the end. Me and Shane, I remember me and Shane, because I went there for, most of elementary school. We were always last. And then on the second row, there's a young girl named Demetria, who I'm actually still friends with today. So this was a peculiar year because it was actually probably the most diverse class that I had experienced during this year, and that kind of changed as the years went on, and it was again more sort of predominantly white. But the reason why I decided to share this snapshot was because it was really at this period in my development that I started to question human motivation, and I really accredit a lot of the experiences that I had in my early childhood to my decision to not only become a psychologist, but also to develop an interest in African American mental health. So a year prior to this, one of my earliest actually childhood memories was of a child in this class calling me the N-word and spitting at me. Those experiences were very confusing and painful for me as a child, and it really motivated my interest in human motivation, but it also motivated my interest in myself. So, being a young person, a young child who was raised in a predominantly white school and neighborhood, there were moments in my adolescence, my early adolescence and in my childhood where I really struggled with my racial identity and having a sense of racial self-pride, which I'll talk about is instrumental to a healthy Black or African-American psyche. And it also motivated my interest then in African-American mental health, sort of understanding the progression of my own racial identity. And then at some point in my professional career, I wanted to use that information to be of service to others. So I share this because I think that had it not been for the experiences that I had around this age, I'm really not sure that I'd be a psychologist. I'm definitely not sure that I would have the interest in African-American mental health that I have. And it's kind of, really motivated me and made me feel driven to really be involved in African-American mental health in general. So kind of shifting to some recent narratives. I'm just going to read these narratives out to you, and then I'll kind of later on especially talk about the implications of them. So during a routine traffic stop in a suburb of St. Paul, Minnesota, Philando Castilla, was shot 7 times and killed by police officer Geronimo Yanez. Castilla's girlfriend and her daughter were in the car at the time of the death. Neither Castilla nor his girlfriend committed a crime. His girlfriend was handcuffed and placed in a squad car shortly after the killing. Yanez was found not guilty for the killing, even though the crime was ruled a homicide, and large portions of the incident were captured on video. Another narrative. The Department of Justice and U.S. Attorney's Office investigated the Chicago Police, or CPD, in the aftermath of a fatal shooting of Black teenager Laquan McDonald by Officer Jason Van Dyne. These agencies concluded that CPD officers engaged in a pattern or practice of using force, including deadly force, that is unreasonable. Officer Van Dyke was eventually found guilty of second-degree murder. Lastly, in a study of women scientists working in the fields of science, technology, engineering, and math, nearly half of African-American women scientists had experienced being mistakenly identified as custodial or administrative staff, as compared to 1/3 of white women scientists. African-American women attributed the incidents as because of their race, while white women believed that it was because of their gender. So it's important to be aware of the social and socio-political conditions under which students of color, primarily African-American students for the purpose of this presentation, under which they live. But I'll kind of shift a little bit to racial identity in a moment. It's important not to assume that because these are the socio-political conditions that, all African-American students will respond to or have the same reaction to these. So for instance, when I talk about racial identity, I'll talk about the pre-encounter phase. People that are in or have attitudes that are consistent with that status do not attribute events in their life to race. They actually have what's called a pretty low race salience and focus more on what it means to be a person. So this would be someone who takes more of a colorblind approach. So we all kind of have an awareness perhaps of, these conditions. But what's important to note is that, African Americans in general are very heterogeneous, which I'll talk about. So here's some relevant stats. So African Americans make up about 13% of the population. However, we're about 40% of the incarcerated. So this is in comparison, for instance, to Euro-Americans who make up about 64% of the population and 39% of the incarcerated. The poverty rate for African Americans remains nearly twice as high as that of all households. So that's about 25% versus about 15%. Unemployment rate is over twice that of European Americans, so about 9.5% versus about 4.6%. And then the wealth gap is considerably different for African Americans, with European Americans' net worth being about 13 times greater that of African Americans. Unfortunately, there seems to be a downward mobility for African American men, with 38% perceiving that or experiencing downward mobility out of the middle class, and that's compared to 21% of European American men. And then health disparities, there's a lot of health disparities when it comes to the African American population, and it was really hard, again, to sort of narrow down what would be most important to discuss for the purpose of this presentation. But a couple of things to mention: infant mortality for African Americans is over twice that of European Americans, and the lifespan for African Americans is about 5 to 6 years shorter than that of African Americans. Now, this, I know, paints a pretty grim picture when it comes to the outlook for African Americans, but it is important to note that most of the research and most of the literature is based on lower SES populations. And so what's not reflected in these stats is that about 38% of African Americans are in the middle class, with 12% being, upper class. And sometimes when we look at stats like this, we have to sort of acknowledge that it doesn't really represent the diversity that exists in terms of socioeconomic status, educational attainment, or things like that. But these stats are still relevant in the work that we do with African Americans, because it is a snapshot of some of the conditions under which many African Americans live. Any questions so far? Okay. So, as I mentioned, African Americans are very heterogeneous in terms of our ethnic and racial identity, our social class, education level, and political orientation. So even though I'm painting this really broad stroke with the information that I'm sharing today, it's important that whatever information that's applied to certain students needs to be assessed in terms of its relevance. So while it's good, and we learn this as clinicians, and when we learn about different populations, we don't use that as prescriptive. We just kind of use it as a framework or a blueprint to understand the students that we work with. I want to talk about racial identity. It's a clinical concept, but it is really important. It plays a major role in students and African Americans' mental and physical health. There's a model by William Cross, nigrosense, it's a Latin term for describing the process of having a raceless identity, in this case, to having a positive Black identity. So Cross began developing this model in the 90s, and it's gone under several kind of edits since then. So it used to be a stage model where someone was conceptualized as moving from pre-encounter to encounter to immersion, but now he kind of views it more, the research supports more it being a status sort of situation. So a person can, for instance, have attitudes that are consistent with more than one status. They don't have to move through one stage and go to the other. But pre-encounter describes someone, as I stated before, who perhaps identifies more with being American than being African American. So if this were someone, if they were in your office, if they were having issues or trouble, they would be very unlikely to attribute it to anything having to do with racism and discrimination. And even though from your perspective, it may be kind of, perhaps obvious that that's what's happening, this is not someone that would view it from that perspective. So this is someone who, would say something like, well, our race doesn't really matter. It doesn't really affect my life that much. Whereas encounter, now someone who has attitudes consistent with this status will often have had an experience where maybe they experienced some type of microaggression, like subtle racism, or maybe even something more overt. And then they really begin to question their identity as an African American or a person of color. Someone who's in immersion is this is someone who's very Afrocentric, very pro-Black, and sometimes this also is accompanied by anti-white attitudes. If that's not always the case, you can be pro-Black without, harvesting anti-white attitudes, but sometimes that is the case. And it makes me think about my own experience, for instance, of teaching the African American psychology class here at UWF. When I first started teaching that class, I had students who really didn't have a lot of knowledge about African American culture or African American history, or especially not African American psychology. And so many of them came in the class with probably more attitudes that were pre-encounter. Now, by the time they started learning about themselves and about their history, I had students coming in dashikis. I had students, that were talking about starting student organizations who were kind of had this attitude of advocacy. But with that, some students were harboring a lot of resentment toward Euro-American, and they really kind of struggled to have this pro-Black identity and not harvest those anti-white attitudes. So those often come in hand. Lastly, there's internalization. So this is a person who does have a strong or positive Black identity, but they also identify with other roles. So for instance, I am a licensed psychologist, I'm a teacher, I'm a mother, I'm a wife, and I'm also African American. Now, those identities all are meaningful to me. That would represent someone who's more in the internalization status. And in terms of psychological well-adjustment, people in the internalization status tend to be the most psychologically well-adjusted. Now, the implications here, as I mentioned before, people in pre-encounter tend to be less likely to report racial discrimination. People in immersion level tend to be least satisfied with those societal conditions. So some of the conditions that I described at the beginning of the presentation, someone in the immersion level is going to be all about that. They're going to be aware of it. They're going to be following it in the news. They may have an attitude of advocacy, or they may be very sort of Afrocentric. And then, as I stated before, someone in the internalization phase or status tends to have the best psychological adjustment. So people who African Americans in general tend to prefer therapists. These are some of the clinical implications who are on the same racial identity stage. Higher pre-encounter levels are associated with a preference for your American therapist. And then people in the latter statuses tend to prefer African American therapists in general. Obviously, counselors who are seen as culturally sensitive tend to be seen as more competent. And just in general, people, African Americans who have a preference for a Black counselor tend to have elevated cultural mistrust and a strong internalized Afrocentric attitude. So I'm curious, this is a question that I'm asking to you. So feel free to unmute yourself because I can't see everybody and answer this if you'd like to. How do you think this information is applicable to the role that you assume with African American students?
Hi, that's really interesting. My name's Judith, I'm from England, but makes me feel like if we're switching it, that you mentioned the high internalized mistrust.
Mm-hmm.
That could be also, say, if you're teaching in a university,
mm-hmm.
students may not want to go to you first or go to someone sure. White or of the same background that they can relate to.
Mm-hmm.
But yeah, that just dawned on me that yeah, my
mm-hmm.
feelings. I teach in a uni setting, and yeah, it's interesting. Thank you.
Thank you for sharing that. That's absolutely true. And also what you might find is that, you know, if students are at a predominantly white institution, so they really have no choice but to seek guidance or help either from a teacher or a counselor or a staff or a faculty member, they may not be as forthcoming about what their problems or issues are. And they may, you know, be a little bit more guarded. So it may require a little bit more patience. And I'll talk, you know, specifically about some of the skills that you can use in developing rapport when that's the case. Thank you, Judith. Okay, so I mentioned before that I think that it's important to talk about the family structure. So this consists in the African-American family structure. Again, I'm painting a broad stroke, but you know, you can assess whether or not this information is applicable given the students that you're working with. But it typically consists of both nuclear family members and extended family members. So for instance, it's not uncommon, it's actually more common for African-American households for the grandparent to be present and to live with the family. That's more common compared to other racial groups. Now, fictive kin is also something unique to African-American culture, and this is having close family friends that are considered family members. So you might be working with a student who's talking about an auntie or an uncle, and then you may realize that, oh, this isn't like a blood relative, but they really do perceive them that way. And having that awareness, and also talk more about the strength of the family structure, can really help you not only to build rapport with that client, have understand them in their context, but also utilize this as a strength if that's necessary in your work with them. The family may play very important roles in promoting a person's health and well-being, and it is more of a collectivistic sort of point of view. So the reason why that's sort of important, especially when it comes to college students, is if you're operating from more of a Eurocentric perspective, you could really expect, okay, someone moves out of their house when they're 18, and then they're supposed to make decisions for themselves. They're supposed to operate independently. You're an adult now. Why are you talking to your parents about this? So for instance, you might have someone who you're working with who's a nursing student who doesn't want to be a nurse, but you know, her mom was a nurse, her mom's mom was a nurse, and she's connected to the part of this system where, you know, this is the expectation of her. It can be very easy to invalidate a person's culture by saying, just don't be a nurse. You're an adult. You know, if you don't understand that, well, this, you know, the African-American family structure, she is a part of this system, and it is not that simple. And in my work with, you know, African-American clients and students, sometimes when this is the case, this person actually gets the degree in nursing, works for 5 years as a nurse before prioritizing their own self-interest. And that's something that they had to do. So it wasn't, I couldn't talk them out of it. It wouldn't have been appropriate to talk them out of it, understanding the person from their context and assisting them and perhaps understanding themselves and what's motivating them. And this situation was just more important and valuable than talking them out of their culture, for instance. So looking at this from the perspective of a strength, men, women, and children tend to adopt multiple roles in the African-American family system. You might have older children that adopt a caretaking role. You might have a married couple where the woman in the heterosexual couple is the primary wage earner. Not uncommon for friends and grandparents to aid in raising children. So it's a family structure that is, there's a lot of flexibility in the roles that are taken by members of the family. So in terms of the implications here, as I mentioned, perhaps being willing to work within that family structure. So that was the example of the nursing student. So, you're not talking someone out of their culture and instead helping them to realize, okay, so this is why this is important to you. Perhaps this is a path that you need to take. This is a scratch that needs to be itched because it's a part of your culture. Also, if in family systems, the African-American family systems, if there are flexible roles, then you might find yourself assuming flexible roles with these students as well. So when I worked in college counseling, I had a student that I worked with who, had mental health issues, real mental health issues that we were working on, but she was also really struggling in math and scored average or above average in every other class, but was failing, could barely pass a math class, and had been told for most of her life that the reason why she wasn't good at math is because she was lazy or because she had behavioral problems in that class. And so what we learned is that, when someone in general can score average or above average in most subjects and is struggling in one particular subject, it's usually indicative of a learning disorder. So I explained that to her, referred her to the appropriate resources. I wasn't a case manager, and I certainly wasn't in a role of, necessarily advocating for her in terms of her academics. But having done that, she was diagnosed with a learning disorder because it was accurate. She did have a learning disorder. And then she got the services that she needed. She didn't even know about the Student Accessibility Resource Center, had no idea that she might have accommodations that were available to her. So I had to assume a role other than that of a therapist to assist her with the problem that was bringing her into therapy. So you might have to navigate through some of those community systems, whether they be educational systems in this case, obviously, because we're all educators or working in higher education environment. You may even want to be aware of the judicial system and the effect there. So I talked about those stats and talked about relevant stats. Well, one study that is also important, sort of relevant to the topic, was done on a group of men, African-American men. I think this was in 2016, maybe, but they were high wage earners, so, $75K or more. And, they still, 6 out of 10 reported that they still had some type of experience with racism, that they knew someone who had either been murdered or incarcerated. And so, mass incarceration, which is something that I could have a whole nother, presentation on. There's a really good book called The New Jim Crow by, I think, Michelle, I'm not sure what her last name is, that talks a lot about this, but it's something that affects the community, and it's not just affecting members of the community that are lower SES, it really affects the community at large. And so it's important to be aware of those types of issues in working with this population. Now, spiritual and religious values are also instrumental to the African-American psyche. About 75%, at least in one study, reported of African-American participants in one study, reported religion and spirituality being a major element of their identity and something that really promoted mental health, that was important and significant to their mental health. For a lot of people, church participation provides comfort. Sometimes it can provide economic support. You may be actually, working with students who are getting economic support from their churches, whether or not it be a scholarship or books or, things like that. Helps with self-expression, development of leadership skills, and just having a community and a sense of sort of people or personhood. The implications here is that sometimes, depending on your own sort of religious beliefs, you may be able to still have a conversation about church activities and that being incorporated into the discussion. Now, this is obviously not something that, again, you want to be prescriptive about. So if someone comes into your office and they haven't said anything about their participation in church or religious identity, and then you say, well, have you been to church? Now this is a little bit of a value imposition. So if it seems that this is a strong value that they hold, you might want to use it as a source of strength. I mean, maybe students have moved from a state where they really had a sense of community or a church family, and now they're in college in a new city and haven't found that yet. You realize that there might be some encouragement there. Have you thought about finding a church family here? What has that process been like for you? Knowing that it could really be a protective factor for many students, African-American students. Now, shifting a little bit to something that I think we'll all be interested in, not to say the other topics weren't interesting as well, but educational characteristics. So African-American families tend to encourage their children at a very early age to develop career goals. Now, when we look at the likelihood of African-Americans in general attending a 4-year institution or a 2-year institution, they tend to be more likely to attend 2-year institutions, although all of this research that I'm talking about is really focused more on African-American men. Unfortunately, African-American women and girls have kind of been left a little bit out of the research. Now, when we look at research on from K to 12, students, African-American students are 2 to 5 times more likely to be suspended, and then they're also more likely to receive harsher consequences when compared to their white peers. School staff, according to the research, tend to hold stereotypes against African-American parents, viewing them as neglectful, incompetent, and overly misplacing the blame on the school for their issues. Now, this is important to colleges and universities because many students are coming to school, to college for the first time with this having been their experience. So, whereas if you have a student who's coming in where they didn't have experiences like this, they might ask you about resources. They may know about resources. They might expect that. If you have a student who's coming from, a more negative educational environment, they may be less likely to see, they may not even know about the counseling center or student accessibility resources. And they may be less likely to reach out for those types of resources, thinking, again, because having the framework that they have based on having had negative experiences before. So some of these other implications, again, the implication of having a negative educational environment, it colors your experience and your expectations. So any intervention should consider the context in which the student operates and identify individual and system level changes. So for instance, the example that I gave, the context in which my client operated, she didn't have very positive educational experiences. She was a first generation student, so she didn't realize that she may have a learning disability. She just was told in K through 12 that she was lazy and wasn't trying hard enough, which is often the case with people with learning disabilities, or that she had behavioral issues and wasn't able to sort of concentrate, didn't like math, that kind of being the narrative. So knowing that, but also knowing what a learning disability looks like and how those are diagnosed, I really kind of advocated for her to get the diagnosis, that she could get the resources from the university that she needed to graduate. It's really all she wanted to do was to get out of there and to graduate and begin her career. So just to kind of summarize some cultural strengths, having a positive ethnic identity, so being more in the internalization phase in terms of the cross model, is a protective factor when it comes to racism and discrimination, which is what I will discuss next, and also just chronic stress in general. One of the strengths of the African-American community is the resourcefulness and coping skills to deal with societal issues. So, having the family, having the extended kin, having those flexible roles in the community systems, those are all strengths. Having that achievement orientation and that being something that is instrumental in many African-American family systems, saying you're going to be achievement oriented. You're going to go to college or you're going to get a job and be able to support yourself. And then the research really supports that having spiritual beliefs and practices tends to serve as a pretty major protective factor for African Americans. Specific advantages to the family structure, again, having that extended family. So if you're operating from the position, again, that's a little bit more Eurocentric, that you're 19, you're 20, why is your family still making decisions for you? You might be inadvertently cutting someone off from their support. So it's important to know that this is actually something that's really important in the African American family structure. Okay. So just kind of shifting a minute to racism and discrimination. Again, very broad topic, and I really kind of struggle to narrow this down, but there are a couple of things that I'm focusing on. One is the impact of the media, and the other one is the judicial system. So I've talked a little bit just briefly about the incarceration rates, mass incarceration, and the impact that might have on the African American community. I'll highlight that just a little bit more. But in terms of media portrayal, even though African Americans, at least in one study, only constituted about 27 of those arrested and charged with a crime, they actually made up about 37% of the news stories, which paints a very deceptive picture of the African American community. In a study by Weir in 2014, when Euro-American participants read descriptions of a juvenile offender who was convicted of rape, they supported harsher sentences when he was described as African American. And then this has been replicated in the research that defendants with darker skin and broader noses were twice as likely to receive the death penalty compared to those who looked less stereotypically Black. And this is also true when for darker skinned women compared to lighter skinned women. They tend to get harsher sentences in general as well. So youth with an incarcerated parent have pretty, specific challenges. There's an increased risk for poverty. There's an increased risk for school failure, obviously emotional distress, criminal and drug activity as well. The implications here, one thing to note is that African American families tend to approach racism and prejudice differently. So there are some who will ignore the topic of race and focus more on human values. And unfortunately, their mental health outcomes tend to be poorer than those who help their children to develop a strong Black identity. So what does that look like? That would be being intentional about, teaching children about African American culture and history, beginning in Africa. So that's actually, again, I could have done a presentation on that, but part of having a healthy African American identity is knowing that African American culture is not born from racism, and having some, or slavery rather, and having some awareness of the accomplishments of our African ancestors. Just that alone, when I was teaching the African American Psych class, just that alone, like knowing and having that knowledge of that being, the student's ancestry helped to develop that positive ethnic identity and self-esteem. Now, to summarize, effective leaders must be knowledgeable of the characteristics, some of the characteristics that I've described, being able to view some of these characteristics from a strength-based perspective instead of viewing them from a weakness or areas for growth. Obviously, having some awareness of ethnic and racial identity and being able to sort of identify to some degree where your students fall is helpful. Respecting and honoring and having some type of awareness of the family structure. Being able to have a conversation about spiritual and religious values without imposing your own views onto the person is really important. And then kind of being aware of how those educational characteristics or experiences might impact a student's disposition, their ability to ask for help, or even awareness of what resources are available to them. Also recognizing that there is a lot of diversity among African American students. Identifying your own racial attitudes is really important. And if necessary, being ready and prepared to address mistrust if that exists. Assessing the problem in response to the situation. So being able to acknowledge if a student is discussing, having an experience of racism or discrimination, validating their feelings about that experience, validating that this was in fact their experience instead of playing the devil's advocate. It's probably one of the worst ways to respond to someone telling you about a racist event, to say, well, could you think about the other person's perspective? And then just normalizing students' feelings in general. Those are all ways to really help to build rapport and trust if that's an area that is a struggle. Here are some of the resources that I used for today's presentation. And now I'm open to Q&A. So I'm happy to answer any questions that you have. And Abraham, I think you mentioned that you might facilitate this. So if you want to,
Yes.
if you would like to share your questions in the chat, you can do that. Abraham can read them and I'm happy to answer them. Or even if you just like to unmute yourself and state your name and then, ask whatever question you have, I'm happy to answer.